Colleagues, friends, we will be starting momentarily, so could I ask you please to take your seats so that we can start with the program?
Very nice to meet you. I've just received wonderful. Thank you. Thank you very much. Yes, no, it's wonderful.
Colleagues, friends, could you please have a seat so we can start with events? Excellencies, colleagues, friends, it's really very good to see so many of you here this evening who were key participants in making this day an official UN celebration, Universal Health Coverage Day. We rely on all of you to be involved as key participants in ensuring a very strong political declaration next September. My name is Werner Obermeier. I'm with the WHO, the World Health Organization, and we are very happy to sponsor this event with several member states who have recently come together to form a group of friends for universal health coverage. In the World Health Organization, it's our vision to reach 3 billion more people in the next 5 years. 1 million better protected, and 1 billion ensuring for them better access to health care, and 1 more billion having access to universal health coverage, which really is the umbrella which covers all this work. The program that we have for you this evening is available on the seats. And after we are done with the panel discussion, we would very much like if you stay and have a glass of beverage and something to eat with us and celebrate this occasion. It is my great honor to welcome the Deputy Secretary General to deliver opening remarks. You know, she has been a very strong advocate for universal health coverage in her current office, but also for many years earlier in all the work that she did in senior positions in preparing for and leading up to the 2030 Development Agenda. So we owe her a great deal of gratitude, and it's a privilege for me to offer her the microphone. Madam.
Thank you very much. Good evening, everyone. It's wonderful to be with everyone in the evening, my second to last event of the day. Happy Universal Health Coverage Day. But this morning, my first event was one of those early calls, well before office hours, trying to meet the timeline of Nairobi. And this is because the WHO global management were meeting there to address how they were going to implement the strategy, but also within the context of the reforms. And it was a wonderful gathering of all our experts, all our leadership, over 315 who were really there interrogating this agenda and the importance of it and how they were going to feed this in with work all the way to the GA next year. So I'm really happy that I close the day again reinforcing how important this agenda is to the SDGs. Real pleasure to be with you today to observe the first day. The new addition to the UN calendar is rooted in the fact that while health we all know is a fundamental human right, at least half of our world's population still does not have full coverage of essential health services, including for mental health needs. And approximately 100 million people continue to be pushed into extreme poverty because of healthcare costs. Health is best addressed, we know, through a multi-sectoral action and comprehensive approach, integrated services, and efforts to target the social determinants of poor health. So really going across the whole spectrum to make sure that we have a sustainable approach to investing in health. Our universal health coverage means that all people have access to health services that they need without suffering financial hardship for paying those services. And as such, one of the best investments to ensuring the success of the 2030 agenda. And we all know that if we really hang on to the health goal, all others will be fed by it as it feeds the goals. Today we are working really hard to get a good outcome of the climate agenda in Katowice. And one of the big issues there has been health and pollution. And more recently, the facts and figures on that are horrific if we are not really going to deal with some of the investments we need to make in climate. Improvement in health in recent decades, I think we have to acknowledge. The glass is somewhat full. We still have a bit to fill, but recent decades have increased life expectancy, reduced maternal and child mortality by half, especially by scaling up immunization. Immunization that was a luxury for so many is now becoming much more of a norm, and investments with our government seem to be increasing. But also save lives from HIV, TB and malaria. These results have demonstrated universal health coverage. 1 billion more enjoying better health and well-being, and 1 billion more being better protected from health emergencies. These are huge ambitions, but they're all doable, and the way and manner in which we can collaborate and strengthen the partners at the country level will make that a reality. As we know from our experience of the Millennium Development Goals and now the SDGs, goal setting has been a proven way to focus the mind, to forge partnerships, and to rally our partners in different constituencies. So I hope that we can work in that spirit to achieve universal health coverage, that we begin to increase, I think, the momentum for breaking silos amongst the health challenges and health sector actors. This is going to be essential to ensuring that the integration of all issues happens under the umbrella that we're wearing. UHC, it is a political choice, one which all member states have agreed to deliver by 2030 as part of the 2030 agenda, and I'm so pleased to see many of our PRs here from Japan, from Thailand, from Hungary, really paying so much attention and commitment and passion to this. Important milestones have already been reached in a national context and internationally. The Global Conference on Primary Health Care recently convened in Astana, Kazakhstan, and thank Your Excellency for being here, but also for providing an enabling environment to really have constructive discussions. It was a key stepping stone towards next year's high-level event at the General Assembly on universal health coverage. And that event is happening at a momentous time because it is the first stock-taking of all SDGs in the high-level political forum. It is also a moment in which we will look to see how well we are or not doing on the finance agenda. It's an important time because we will have the climate summit. And I think most of all, when we say that we're going to target those who are farthest behind first, the last of those GA events next year will be about the Samoan pathway and our SIDS. And we know that they are one of the most vulnerable groups that we have in our UN family. So we've got very high hopes for the meeting, and we look forward to working with you to make a success of it. We're looking forward to our shared commitments, especially of that of which we always underscore, no woman should die in childbirth. That for me is important, coming from a country where we have indices that are totally unacceptable to us, and that we try to reduce day by day, year by year, and that every child celebrates their 5th birthday. This is so important. It's a real pleasure to be with you, but more importantly, to be with you on a journey that is tough, but that we can go much further together, and that we can be sure that 2030 will have that glass full and not as it is today. Thank you.
We are now going to see a short video message from Dr. Tedros, the WHO Director General, after which I will invite all the panelists to take their seats up here. It will not be a long movie, so I hope you will not lose attention.
Happy Universal Health Coverage Day. UHC is a simple idea that everyone should be able to access the health services they need without suffering financial hardship. Globally, we have a lot of work to do to realize that dream. At least half the world's population cannot access essential services like vaccination, essential medicines, or the ability to see a health worker. And every year, nearly 100 million people are pushed into extreme poverty due to out-of-pocket health spending. But there are many countries in which UHC is becoming a reality. India is now rolling out a massive initiative to provide health coverage for 500 million people. Kenya is expanding access to essential services by removing financial barriers to care. And the Federated States of Micronesia is developing a comprehensive package of services to ensure all its people scattered across hundreds of islands can receive the care they need. In many low and middle income countries, health spending is increasing faster than the rest of the economy. And countries are relying more on public funds to finance care and less on people paying for it out of their own pockets. The Foundation for Universal Health Coverage is primary health care that delivers the services people say they need, not the services someone else decides they should have. Next year, presidents and prime ministers will gather at the United Nations General Assembly to commit to universal health coverage. You can help. Lift your voice. Call on your country's leader to be there for this historic moment in global health. Join me and join WHO. Join the movement for a healthier, safer, fairer world.
Dr. Tedros is of course traveling, but he told me that he will be watching the live stream later, tomorrow probably, when he has had some rest. The event is being recorded and will be shown live, but you can also, of course, watch it tomorrow. I would like to first invite Ambassador Koro Besho, permanent representative of Japan, to speak to us about the recently formed group of friends on universal health coverage and what the objectives and aims of this group would be. Please, if you want to sit, you're welcome, or you can come to the podium.
Good evening, ladies and gentlemen, and it's so good to be here with all of you. And I have to, first of all, thank Amina for being here with us and for those very strong words of support for the UHC. I really appreciate that. And thank you for all the champions of UHC gathered here today. As Werner said, I don't need to tell you the importance of UHC. Amina has said a few words which I think were very, very important. But let me just start from my own point of view. Because the General Assembly, the United Nations member states, have got together to talk about some series of health issues which we thought that the heads of governments should look at and try to contribute to. And those were HIV/AIDS. We had a high-level meeting on that. Non-communicable diseases, antimicrobial resistance, and then most recently tuberculosis. And I had the privilege of being a co-facilitator of the high-level meeting for the tuberculosis. And it was a very wonderful experience doing that together with my friend, dear friend, the Ambassador of Antigua and Barbuda, Aubrey. He is there, and we want to keep on working together with him. And again, I don't think I need to explain the importance of UHC to this audience, but I think the important thing is that while we have looked at these important series of issues, health issues, UHC is really the key. We need to have more acceptance, more work on UHC so that we can make use of the progress we made in these individual issues and to ensure that UHC will be the fundamental enabler for achieving these issues. And for that purpose, I and a few other PRs have got together, and so today I'm very happy to announce that we have formed a group of friends of UHC as an informal platform for all UN, open to all UN member states, and in New York. And the purpose of the group is to build momentum in support of the newly reappointed co-facilitators, our friends sitting right in the center of that group. And so that we can have a meaningful, useful, high-level meeting on UHC next year. And we would like to continue this work as a group of friends towards achieving UHC in 2030. And as our Deputy Secretary General said, this is really something that we cannot wait. We really need to work on this right now. I'm very happy to say that around 30 member states have already become members, but I'm sure there are others from different missions here. If you're interested, we have distributed the concept notes. It's on the table as you entered the room, so if you could look at them and join. If you're interested in joining, please let us know, because as far as we are concerned, the more friends we have, the better for UHC. So I really feel that it's going to be very important to have briefings, consultations, so that we are more aware of UHC and try to spread the news to the other member states of the United Nations that this is something that we really need to work for. And the first of these briefings and consultations we will be having tomorrow morning at 8:30 in conference room 11. It's a little early in the morning, so while I would encourage you to enjoy yourself and have some drinks, do it in moderation so you can come out early in the morning. Talking from our own country, we have had the honor of coming to have a UHC which has really helped our health issues. But next year, we would like to make use of the events that are already planned. We are hosting the G20 summit in Osaka in June. Then we will have the 7th Tokyo International Conference on African Development, or TICAD 7, that will be in Yokohama in August, so that we can make use of these events to leading up to the high-level meeting on UHC in September. So let's work together and let's live up to our commitment, a joint commitment that we leave no one behind, and we do this through ensuring UHC. Thank you very much indeed.
Thank you, Ambassador Rachel, and congratulations to the permanent representatives of Thailand and Hungary. It's going to be a long, tough road ahead, but we are looking forward to following your guidance. May I ask the Ambassador of Thailand, Vivida Srivihok, permanent representative, to speak to us about Thailand's experience in leading universal health coverage, not only in their own country, but also across the region. The long champion of UHC.
Good evening, distinguished participants, Madam Deputy Secretary General. Let me start by saying that the good health of the people is the wealth of nations. Yeah, this is the main policy of the government of Thailand. First, I wish to thank the WHO for organizing the commemorative event for the first official International UHC Day this year. And it is a great way to kickstart the preparations for the upcoming high-level meeting on UHC next September. With your office great support, the foreign policy and global health initiative, which we had the honor to serve as chair in 2018, was able to gain support from a number of member states last year on this very same day to proclaim 12 December as the International UHC Day, a day that has long been commemorated by various stakeholders outside of the UN since the year 2012. I would also like to express our appreciation to Ambassador Rachel of Japan and his office for their leadership on this issue, including through the recent creation of the Group of Friends of UHC, whose membership is constantly expanding, which surely indicate that the momentum is growing. We are glad to be part of it. Thailand was able to achieve its UHC system since the year 2002, initially funded mainly by tax and general government revenue, allowing the whole of its population to access all basic health services at a significantly low cost. Our work over the decade bear fruit in the reduction of infant mortality rate by 1/3 and a continuous decrease in household health-related expenditure, preventing families from falling below the poverty line or facing financial hardship as a result of prolonged treatment or expensive medicines. Now, coming to the point as a developing country, we have continuously been advancing UHC at the international level by sharing our knowledge, exchanging best practices, and giving assistance and on-site support to other fellow developing countries through various channels, mainly through the Ministry of Public Health, the National Health Security Office, and the International Health Policy Program, as well as through Thailand International Cooperation Agency, or many of you know that is a TICA, under the Ministry of Foreign Affairs, giving priority to countries in our own region. Obviously, the keys to our success on UHC are, first, the close coordination between the two ministries. Second, the unwavering strong political view and commitment at the highest level. And the third one, the high importance we give to the health workforce and the UHC champions in our country. Today, over 2,000 health personnel from 49 countries receive training from the Thai health sector. Among those include health personnel from Indonesia, Laos PDR, Myanmar, and the Philippines. This success owes much to the project initiated and funded by the Rockefeller Foundation back in the year 2011, called the Capacity Building Program to support the movement in achieving UHC, or CAP UHC, which still continue to be carried out even after the project conclusion. We are also glad to partnering with Japan under the Partnership Project for Global Health and Universal Health Coverage, or GLO plus UHC. In addition, Thailand has played a key role as chairperson and secretary for ASEAN Plus T UHC network established in the year 2014 to promote UHC in the region, and we will continue to scale up our efforts, as we will have the honor to take up the chairmanship of ASEAN next year, with the aim to advance partnership for sustainability. Before I conclude, as in the coming days, I am expecting to soon be reappointed as the co-facilitators together with the PR of Hungary to co-facilitate the process for the political declaration of the high-level meeting on UHC. I wish to say that next year will be an interesting year ahead. It will be the first time member states deliberate at length on universal health coverage at the United Nations. Suffice to say that UHC is an indispensable overarching factor for the achievement of the whole SDG 3, and that the good health and well-being of our people is integral to the achievement of the true sustainable development as a whole. My own delegation has already been devoting our resources and time to do the groundwork and build a solid path towards the high-level meeting on UHC, and in the capacity as the soon-to-be co-facilitator, I stand ready to put all my effort into this process, and I hope to receive support from member states along the way. Thank you very much.
Thank you. Ambassador Kathleen Botke, permanent representative of Hungary, and soon to be announced other co-facilitator. What motivates you to be a tireless champion for UHC, and how are you going to navigate the waters ahead?
Thank you very much, Madam Deputy Secretary General, Your Excellencies, these friends. Frankly, I didn't know about your question, and I was thinking about what I wanted to say as an introduction, which is exactly the answer to your question. Why is it so important for me personally to be part of this very important process? I was born into universal health coverage. I was brought up by and with universal health coverage. And I'm coming from a country where universal health coverage is an everyday, normal action and part of our life. But I know it's not the same situation everywhere in the world. I was brought up in a little village in Hungary behind the Iron Curtain, and my father was the doctor of the village, and my mother was the nurse. And you know, in the old times, the doctors had to do everything. And my father took me very often to his patients to meet the people, because not everyone was well off. There were a lot of poor people. He took me to everyone to see the different social structure of the village, which was a very diverse village. We had Germans living there, we had Croatians, Serbians, we had Jewish people, we had Romas, Gypsies. It was a very interesting mixture of diversity of cultures and religions. And they very often came and knocked at the window or at the door of my father, 2, 3 in the morning, or midnight. And my father took his coat, his little bag, and went. And I asked him, Father, you know, 3 in the morning, I mean, there was already somewhere a hospital, so we could have gone to the hospital. He said, no, I took the oath. I'm here to help to everyone. That is why I'm here and I'm a doctor. And you should remember that you have to give back always to the society if you know something and what is needed. So that's my personal answer to you, to your question, which I wasn't so much planning to elaborate, but that this is my personal commitment, really. And because really I see that in my country, this is part of our life. But I've been living and traveling extensively in the whole world, and I met to different continents, I met different people on the road, and I saw that this is just not so terrible, natural for everybody. Of course, here I would like to thank the dear friend, Ambassador of Japan, to set up the group of friends. We have so many group of friends. Hungary is part of so many group of friends, but I think this is one of the most important group of friends, and I'm sure that more and more countries will join us, because here we are talking about human beings. I think with the universal health coverage is very important, as it is with everything in the UN, which is a very abstract thing in the world, to be very clear what we are doing, why we are doing, with whom we are doing. I remember very well, and Hungary was a committed co-facilitator of the SDGs, that when I started to talk about the SDGs to many people, they didn't have an understanding or a clue what is the SDGs. So we really have to do things here in the United Nations in order to get a better life for the people in the world. But we also have to be able to communicate why and what we are doing. I'm very happy that Hungary is in partnership with the permanent mission of Brazil, Japan, France, Ghana, South Africa, and Thailand. And I'm very honored that we've been asked again with my dear friend, the Ambassador of Thailand, to run this very interesting journey. I must say that after the modalities, the process, what we've done, we have already faced that it won't be an easy journey. And I always say that the UN is about collaboration, it's about discussion, it's about dialogue. So it doesn't mean that we think the same way and we act the same way. The question is how we will be able to understand each other and how we will be able to integrate the knowledge and experience from all over the world into this very important process. We are open, and as co-facilitators, of course, you are facilitating and you are serving the member states. But as I said, me representing my country in this very process is something that makes me very proud. Because universal health coverage is about dignity, is about giving dignity to the people. In Hungary, the strong primary care is the key, what we think in the integrated healthcare system and universal health coverage. The Hungarian government is determined to strengthen and develop quality primary care in line with the Healthy Hungary strategy and the Act on Primary Care. These measures aim to reinforce the prevention function of primary care and reach, with the exception of some special services, that the first doctor-patient contact takes place at a family doctor, where in most of the cases definite care is provided. Since 2010, a great deal of interventions have been made with the aim of strengthening primary health care in Hungary. For example, salary increase, establishment of a reward system for the most effective general practitioners, financial support from primary care development needs, introduction of quality indicators to assess the process of screening, prevention activities, management of chronic diseases. And I would like here to emphasize that for us, what the Deputy Secretary General was talking about, vaccination, is immunization is so very important. It's all part of the prevention. We put a very big emphasis on child care. So we see universal health coverage is really from the moment of pregnancy till our death. The decreased regional differences in availability is again a very important issue, I think, in many countries. Special programs established to ensure the inflow of new doctors into the system, and in order to increase general practitioners' mobility, practice programs are also continued. To support the latter, Hungary participates in a number of programs. For example, the European Union Structural Reform Support Program, where primary healthcare model programs focus on practice communities with the aim of prevention, community orientation, involving local communities, particularly the Roma people. The scope of both preventive and personalized services available for the population will be always expanded. From 2019, the introduction of a unified medical record will also allow general practitioners to list all the risk factors of their patients. We also believe in the electronic health service space, which is another important step, we believe. So what I would like, as someone coming from the family I talked to you about, and I'm coming from a country where universal health coverage is part of our everyday life. I see how important it is, and we would do, I think, the utmost here in the United Nations to work together with the member states. And really, as I said in my message today, we should unite the world to achieve universal health coverage. Thank you very much.
Thank you. Ambassador Kairat Umarov, former representative of Kazakhstan. You played host to the Global Conference on Primary Healthcare in Astana just very recently. And could you please mention to us how you think the outcome of this important meeting can help in the road ahead as we move to the high-level meeting?
Deputy Secretary Mohammed, Mr. Governor, Mayor, Excellencies, ladies and gentlemen. First of all, of course, happy International Universal Health Coverage Day, and I'm glad to see you all here in this hall, and thank you to organizers for inviting me to speak today and talk about the conference which we did quite recently. Let me start just from the history and say that, back in 1970, Kazakhstan hosted the WHO conference in that time former capital of Kazakhstan, Almaty, and it was really a breakthrough. It was a revolution in the primary healthcare treatment because at that conference, this primary healthcare system was adopted, introduced, and from that time on, 40 years, it has been used all over the world. And talking to previous WHO head, Ms. Chang, she said, we have not yet devised something better than this, because we all talk today about prevention, and that is the essence of prevention in medical science. And that makes the cost of treatment much less. It helps people to work on that issues much more efficiently. And we're glad that Kazakhstan, we're not only glad, but we're proud that Kazakhstan was the venue for that. Because for us, primary health care system is very natural and we'll leave it. But as Amina just mentioned quite recently, that universal health coverage, it was a luxury at some point of time, and we never thought about it. But today, when we have a very great progress in medical treatment, medicines, it becomes quite expensive. And of course, not everybody can afford the treatment today. And the figures, it is very important for us all to, again, collectively work on making the life of people better. Because having a good medical treatment, it's a human rights issue. You have to have it, and let's really look at that. So it's kind of an introduction, and since it was a very pointed question which was put in front of me, I just would like to say that the global conference on primary health care, it was kind of a baton which we were taking from 78 to 2018, was held on 25th and 26th of October in our new capital, Astana, in Kazakhstan, and it was co-hosted by WHO, UNICEF, and the government of Kazakhstan. More than 2,100 distinguished experts attended the conference, including 1,196 foreign delegates from 146 member states of the World Health Organization. Of this, 45 were represented at the level of health ministers, 20 were vice ministers, and 85 were heads of international organizations and other institutions. We were honored to have Tedros Ghebreyesus, WHO Director General, himself there, and Henrietta Fore, Executive Director of UNICEF. who addressed the conference, and of course during the visit there were very productive meetings with the government of Kazakhstan and other delegations. Countries representing the entire world actually agreed to adopt a declaration of Astana, vowing to strengthen their primary health systems as an essential step toward achieving universal health coverage. The Declaration of Astana reaffirms the historic 1978 Declaration of Almaty. While the Declaration of Almaty laid the foundation for primary health care, progress over the past 4 decades has been uneven. At least half of the world population today lacks access to essential health services, including care for non-communicable and communicable diseases, maternal and child health, mental health, and sexual and reproductive health. The adoption of this declaration, its further dissemination, and the inclusion of it in resolutions in the agenda of the 72nd World Health Assembly in May 2019, and in the agenda of high-level meeting of the UN General Assembly at the level of heads of state in September 2019, will support and consolidate the collective efforts in implementation of primary health care system and to achieve universal health care coverage. The Declaration of Astana comes amid the growing global movement for greater investment in primary health care to achieve universal health coverage. Health resources have been overwhelmingly focused on single disease interventions rather than strong, comprehensive health systems. This is the gap which was highlighted by several health emergencies in recent years. As our Minister of Health said, the adoption of the declaration at this global conference in Astana will set new directions for the development of primary health care as the basis of health care systems. The new declaration reflects obligations of countries, people, communities, healthcare systems, and partners to achieve healthier lives through sustainable primary health care. And the key word here is sustainable. UNICEF and WHO will help governments and civil society to act on the declaration of Astana and encourage them to back the movement. UNICEF and WHO will also support countries in reviewing the implementation of this declaration in cooperation with our partners. This declaration, unanimously endorsed by all WHO member states, makes pledges in 4 key areas. First, make bold political choices for health across all sectors. Second, build sustainable primary health care. Third, empower individuals and communities. And the fourth, align stakeholder support to national policies, strategies, and plans. Of course, I can talk more about this conference and outcomes of it, but I think this is the gist of what was discussed and adopted. And I really would like to say that we just met quite recently here with Madame Flores from UNICEF, and she was saying that they would like to take the example of what was achieved in Astana this time and replicate it and work with the rest of the world. So she was very much enthused with the results, and UNICEF and I'm sure WHO will work actively to implement it. So I call upon all of us, all our countries, to rally around the outcomes and make very steady progress in implementing of the provisions of agreed achievements for our common good, and of course to have UHC work well for everyone. I thank you.
Thank you, Ambassador. Congratulations again. Could I ask Ambassador Kahar Natsen, who is the permanent representative of Georgia, also on the road towards universal health coverage, there are always a lingering question about resource mobilization, the costs involved. If you could, in your intervention, maybe just touch on that also.
Thank you, Gordon. All protocol observed. Firstly, it's an honor to be here as we celebrate for the second time the Universal Health Coverage Day. As to your question, I must say that I'm pretty proud of my country because we do have universal health coverage for every citizen of ours. And we did it with our own resources. And if we manage to do that, I believe others can do. And you mentioned the resource mobilization. It starts with the political will and the resolve. The resolve of the leadership based on the need that comes from the public. Everything else is secondary. We found money within our budget. Now, other countries may need, of course, help in infrastructure, in training, and that help must come. But we believe that if we managed within our own resources, with the resolve, others can do too. Because universal health coverage is not a luxury, not a luxury for rich countries, it's not a luxury at all, it is a necessity. And if a country like Georgia, a middle-income country, did it, I believe others can do that too again. Today, our world is marked with a lot of inequalities in its various manifestations, and health is one of them. Access to health, access to medicine, and therefore we believe that progressive universalism, ensuring access to healthcare and medicine for all who are in need, is absolutely essential, and that's what we are trying to do. And it was with that mind that we decided to join immediately the call of my good colleagues when we decided to set up a group of friends on universal health coverage, again to sensitize the wider membership and to support, of course, the co-facilitators. Just before we started this event, several of us were talking about the road ahead, and obviously it won't be an easy road. None of the co-facilitations is easy in the United Nations. Hopefully we'll culminate with the resolution and with the high-level meeting, but there is something that I really do not want, and I'll try to work on that at the high-level meeting, we have this meeting not for the fanfare, but for the result. Because universal health coverage, after all, is something that we do need for the populi, and not for populism. Thank you.
Thank you very much for that very important contribution. And as a former president of mine always used to say, everything always seems impossible until it is done. Can I ask Dr. Ilona Kikbush, who is the co-chair of the UHC 2030 Coalition, to tell us how partnership will contribute, because this cannot be done by member states alone. It has to be done by everyone.
Your Excellencies, ladies and gentlemen, dear friends of Universal Health Coverage, I'm delighted to be here again, actually. Some of you were here, or many of you were here in September when we were able to start this movement for universal health coverage for the first time in this very same room. And I think today we have again heard what a fantastic historic opportunity is in front of us. That's something that we cannot do alone, as you said, to move such a difficult agenda forward. And since this is a political agenda, it will be difficult, and we will depend very much on your art and your abilities to negotiate it. If we want to reach universal health coverage, we need a social contract. Universal health coverage, we always say health is a human right, but at the same time, health is a social contract between young and old, between rich and poor, between sick and healthy. And that is why all those groups need to come together to achieve such a goal. And it is important that all these groups come together to achieve such a goal because we need such systems so that the most marginalized, the poorest, the disadvantaged have access to it. And there was one word that the ambassador raised, dignity, that I think is absolutely critical. We often say, leave no one behind. But the issue is to be able to enter, to be part of a system that maintains your dignity, because it is a system for everyone in the society, is an absolutely critical point. And it's a very, very critical point, especially for women. It's a very critical point for those that need special rights, sexual and reproductive health and rights. It's a very, very critical point for people who otherwise might be discriminated against in society, or who have diseases that are dealt with a lot of social stigma. So you can see that while it is very, very important to defend the individual right for health, it can only be lived through a social contract. And that is why we hear so frequently that it is a political choice. So this is one of the reasons that UHC 2030 as a movement has been established to accelerate the process towards universal health coverage. We've set ourselves 3 goals right now, and the next 2 days we'll be discussing in our steering committee how we mobilize voices for universal health coverage. And I underline again those very, very diverse voices, and particularly that important voice over there, which is probably one of the most important in the room, how we can work better together for universal health coverage. And that again means bringing us together all the vertical disease programs, the different levels of universal health coverage, the different system understandings we have of universal health coverage, the different financing modalities. And of course we need knowledge and we need networks. And bringing that together, the voices, the working together, and the knowledge will be absolutely critical. Some of you might know that we are organized according to constituencies. We have an incredibly strong and active civil society engagement mechanism. We are just developing the private sector contribution and have launched the private sector constituencies. And those colleagues will be joining us in the steering committee the next 2 days as well. And of course, we have a strong group of countries that are joining us, and increasingly we are reaching out to all the many alliances and organizations that are disease-focused still, but that have understood the importance of the UHC agenda for their work. So we are very keen to make next year's historic opportunity something that will really support people in their everyday lives and in their countries. We hope that genuine change will happen, and we are here to support in any way that we can that the meeting will bring concrete results and will be a step forward towards the SDGs and towards a global social contract for health. Thank you very much.
Thank you very much, and thank you for rushing here straight from the airport. We really appreciate you making time to come and bring that important contribution. I know we are running a little bit behind schedule, but we have 2 more very important contributions from groups which normally are not focused on and are overlooked in many discussions. I want to ask Amy Carter, who is the Vice President of International AARP, to speak to us a little bit about the importance of UHC for older people, a group which is often not focused on. HelpAge and AARP actually today launched a very important publication which brought very strong links between healthy aging and UHC. If you could tell us a little about that.
Thank you, Werner. Good evening, everyone. Excellencies, distinguished delegates, and ladies and gentlemen. I'd like to start with thanking the World Health Organization, the Permanent Mission of Japan, and the group of Friends for Universal Healthcare, and all the other representatives here of missions here today, for inviting AARP and our partner, HelpAge International, to join you in celebration this evening, in celebration of Universal Health Coverage Day. We're happy to be in the company of such champions of universal health coverage. As Werner said, I want to just talk about our report that brings a different aspect. We've got a very young infant here that spans one end of universal health coverage, and I want to talk about throughout the life course to the other end of universal health coverage. So even though we are champions here today of universal health coverage, we're also aware of the challenges that many older people face in realizing their right to health, especially in low and middle income countries. So two issues around health for older persons are the lack of data in health and national statistical systems, as well as age caps in international surveys. And we support the need for data that are collected to be disaggregated by age, by gender, by disability, and by location. Which is why I'm pleased that, as Werner mentioned, we announced earlier this afternoon with our partner HelpAge International, we released our report, Global Age Watch Insights, the right to health for older people, the right to be counted. So this report illustrates deficits in health and well-being experienced by older people in all regions of the world. It shows how health systems and universal health coverage in particular must adapt in response to global demographic and epidemiological transitions. And the report is, we're very proud of it because we propose a path to practical solution to advance older people's right to health. And I invite you to read the report. There are copies of the executive summary here today. It's also, you can also access it online at www.globalagewatch.org. And I encourage you to share it with members of your network. As Werner said, sometimes older people aren't necessarily always included in these conversations. And building a stronger coalition, a strong group of friends can help us get to our ultimate goal. So we look forward to collaborating with you as champions of universal health coverage to ensure the benefits of UHC extend to all people of all ages, including older people. So I want to thank you for the time and thank you for having us here tonight, and enjoy your evening. I don't want to stand in the way of reception.
Thank you, Amy. And copies of the report is right up front there where you entered. Last but not least, I want to ask Lorraine von Rimmer, who represents Rare Diseases International, to talk to us briefly about those diseases that are also normally not discussed when we talk about the MDGs, now the SDGs, and how strengthening health systems can make sure that those are also not left behind.
Thank you very, very much, and certainly it's a huge privilege to be here, and certainly thank you, Your Excellencies, for certainly the very strong comments, and also to Dr. Kitbush, who's always been a huge champion in terms of the inclusion of those people who are most directly affected by healthcare and actually have a huge responsibility as well to participate. Rare Disease International, for those of you who may not know, is in fact the Global Alliance of Patient Organizations. It's only been very recently formed as a separate entity, so if you haven't heard about it, you haven't really been asleep for a long time. We have just only been officially formed in the last year and a half. It is made up of some 56 national alliances of patient organizations, also some 14 international rare disease organizations and 4 regional alliances, representing more than 100 countries and maybe somewhat around 300 million to 470 million persons. For those of you who may not be truly aware of rare diseases, it's not, the exact prevalence number is not so important as the recognition that rare diseases, quite generally defined, are those diseases that affect individually very small numbers of people. They are therefore oftentimes underdiagnosed or not diagnosed at all. They're oftentimes under-researched so that we know very little about not only what the cause of the disease is, but also the natural history of the disease and also in developing care and treatment pathways for them. And they are oftentimes included in terms of any health system. I mean, I come from Canada, where I'm the president of the Canadian Organization for Rare Diseases. We've had universal health coverage since the 60s. I have 2 children, both born with rare disease, and I can say is that even in the very best developed, rich, well-serviced healthcare systems, patients, families with rare diseases are oftentimes marginalized. So I think it's a very important opportunity for us to be actually included and recognized in universal health coverage. And I think it was a huge asset for us last year when Dr. Tedros made the very strong comment that a country which is going to be introduced and claims to be caring for all of its patients, leaving no one behind, must also make sure it does not leave those with rare diseases behind just because they're few in numbers. I think the other very important thing, though, that I want to say is that we believe that by addressing rare diseases collectively, there's 7,000 to 8,000 rare diseases, but you don't need an individual strategy for each one of those diseases. That, of course, would be impossible. But there are many common strategies that can actually have huge benefits. Things like newborn screening programs. And those also are a good illustration in terms of how addressing rare diseases collectively can actually contribute back to better understanding of much more common diseases. So we are learning a great deal more, for instance, in terms of genetic variations of common diseases, cancer, HIV, heart disease, etc., and being able to focus those strategies. All of that comes out of our work with the rare diseases. So there's a lot that can actually be contributed back. A lot of what we can be doing in rare diseases, and we recognize that, of course, for low middle-income countries, they're just developing universal health coverage. The challenge is, in fact, addressing all of the population. What we want to make sure is that it isn't just a universal health coverage that's only going to be for those more populous diseases. We need to make sure that people who have very rare conditions are not left behind. The other thing that we know with the rare disease population, and it's really illustrated by the patient alliances that have come together. Strong Patient Alliance in Georgia, the very best patient alliance in terms of longevity out of Japan. Hungary, of course, has an amazing rare disease organization that has done so much in terms of not just Hungary, but for the whole Eastern European area. These are all bottom-up strategies. These are patients and people that are involved. And I think it goes back to what we're talking about, is that in order for universal health coverage to actually succeed, you need to mobilize the voices of the people. You need to engage these people and take an active role in terms of helping to implement universal health coverage. We talk about the huge responsibility of people who are receiving and taking advantage of health care to also have a responsibility to give back and to make sure that they are, in fact, contributing to cost effectiveness, the effectiveness of it. So in the rare disease community, I think this is a huge opportunity for us to make sure that as we're looking at universal health coverage, we can develop the strategies, but we can also include those with very, very small or rare diseases. Most of these are genetic diseases. Most of them affect children. 2/3 affect children. Half of those children would die before the age of 5. And yet we could do so much if we did early identification and we were to provide preventive strategies. So I thank you very much for this opportunity. We look forward so much to be able to work with you, and we look forward so very much to actually helping to implement universal health coverage in many of these countries, and also making sure that we're doing our part in contributing back to the whole healthcare system. Thank you.
You that on the left there on the table there are a couple of iPads which have some interactive documentaries called Health for All, the evolving story, and it brings the human story and health through a multimedia application that you can explore while you are enjoying a glass of beverage. Thank you very much for staying with us, for your patience, for all the ambassadors who contributed such valuable interventions, and several other ambassadors who are in the audience that also stayed with us throughout. And please enjoy the rest of the evening with us. Happy Universal Health Coverage Day.